From VOA Learning English, this is the Health Report in Special English. Nigerian doctor Ucha Amazigo has received the Prince Mahidan Award for outstanding efforts in public health. Dr. Amazigo recently traveled to Thailand to receive the award. She has been a leader in sub-Saharan Africa in the fight against the disease known as river blindness. The disease begins when people are bitten by the black flies that spread the infection. The disease is known as river blindness because the flies live near fast-moving rivers and streams. Tiny worms spread throughout the body. This incites the body's immune system to attempt to fight the invaders. But the body's intense response can destroy the eye nerves. The infection can cause not only blindness, it also causes a painful skin disease. The cause of river blindness was first identified in Guatemala almost 100 years ago. The disease continues to be a serious health problem in many African nations and in Yemen. Medical treatment lasting as long as 20 years is necessary to keep victims free from the parasite that causes the disease. Dr. Amazigo is a former director of the World Health Organization's African Program for onchocerciasis control. That is the medical name for river blindness. Dr. Amazigo organized local treatment programs in communities. Now, 117,000 communities under 19 African governments treat the disease locally. In 1987, the drug manufacturer Merck launched a program to provide a medicine called ivermectin to everyone affected by the disease. The company said it would provide the treatment for free as long as necessary through the community-directed program. For VOA Learning English, I'm Carolyn Presutti.
I'm Alex Villarreal with the VOA Special English Health Report. The crisis at the damaged Fukushima Daiichi nuclear power station in northern Japan has raised worries about radiation risks. We spoke with Jonathan Links, an expert in radiation health sciences. He is a professor at the Johns Hopkins Bloomberg School of Public Health in Baltimore, Maryland. Professor Links says workers within the nuclear plant are the only people at risk of extremely high doses of radiation. For other people, he says, there may be a long-term worry. People can get cancer from low doses of ionizing radiation, the kind released in a nuclear accident. Professor Links says scientists can use computers to quickly model where radioactive material has blown and settled. Then, they measure how large an area is contaminated. He says if the situation is serious enough, officials could take steps like telling people not to eat locally grown food or drink the water. But he said that would only be the case if there was a major release of radiation, and if it was shown that the radioactive material was blown over the area and then settled into and onto water, plants, fruits, and vegetables. The reactors at Fukushima are on the Pacific coast. But Professor Links says people should not worry about any radioactive material leaking into the ocean. He said even in the worst accident, the sea dilutes the radiation. So the amount of radioactivity in the seawater would still be quite low. Japan is the only country to have had atomic bombs dropped on it. That memory from World War II would create a stronger psychological sensitivity to radiation exposure, Professor Links says. The 25th anniversary of the explosion and fire that destroyed a reactor at Chernobyl in Ukraine was in April. The 1986 event was the world's worst accident in the nuclear power industry. A new United Nations report says more than 6,000 cases of thyroid cancer have been found. These are in people who were children in affected areas of Belarus, Russia, and Ukraine. The report says that by 2005, the cancers had resulted in 15 deaths. The cancers were largely caused by drinking contaminated milk. The milk came from cows that ate grass where radioactive material had fallen. For VOA Special English, I'm Alex Villarreal. To get the latest updates, go to voaspecialenglish.com.
This is the VOA Special English Health Report. President Obama has signed legislation to make the biggest changes in the healthcare system in 45 years. The president said, "Today, after almost a century of trying, today after over a year of debate, today after all the votes have been tallied, health insurance reform becomes law in the United States of America." Many parts of the plan will fully take effect in 4 years, but some take effect quickly. For example, in 6 months, the new law will bar insurance companies from denying coverage to children with pre-existing health conditions. Adults with pre-existing conditions will be added in 4 years. The government will help millions of people pay for insurance. It will also permit millions more to receive free coverage through the Medicaid program for the poor. In all, the plan aims to make health insurance available to 32 million people now without it. People will be able to buy private policies through marketplaces called exchanges to be administered by the states. Illegal immigrants will not be able to take part. An estimated 83% of people under age 65 who are in the United States legally now have insurance coverage. The plan is expected to raise that to 95% within several years. People over 65 are covered by the Medicare insurance program, which the government created in 1965. For the first time, Americans will be required to have health insurance or face a yearly fine starting in 4 years. The law will also require companies with more than 50 employees to offer coverage. If not, they could face a fine of $2,000 a year for every worker. Also, this year the law will start closing what is known as the donut hole. That is a lack of Medicare coverage for some drug costs for older Americans. President Obama promised senior citizens that the reforms will not cut their guaranteed benefits. The Senate quickly made a last set of legislative fixes needed in the new law. However, some states have already gone to court to fight the new health care reform law. The health care plan is expected to cost about $940 billion over 10 years. But it is also expected to help reduce the federal budget deficit. And that's the VOA Special English Health Report. You can comment on this story at our website, voaspecialenglish.com.
This is the VOA Special English Health Report. Malnutrition remains a serious problem for India. But a new study shows that India's leading causes of death now also include obesity-related diseases, such as heart disease. The Registrar General of India released the report in April. India's current National Family Health Survey shows that more than 20% of Indians living in cities are overweight or obese. And in the northwestern state of Punjab, that is true for almost 40% of women. Aradhana Tripathi is a business professional in New Delhi. She said eating is the most important thing in any Indian household. You show your love for a person through the kind of food you serve him. And the inactive lifestyle is one of the reasons why the number of obese people in India is increasing. Aradhana Tripathi says she decided to lose weight after she got pregnancy-related diabetes. Her mother and grandmother are also diabetic. In fact, the International Diabetes Federation says India is now the diabetes capital of the world. It says 1 out of 6 diabetics is Indian. Genetics may play a part. Researchers say Indians store more body fat per kilogram than Europeans. That means obese Indians are even more at risk for diabetes than other people. Anup Misra is Director of Diabetes and Metabolic Disease at Fortis Hospital in New Delhi. Dr. Misra says the risk of diabetes is crossing social and economic lines. 5 years ago, he says, obesity and diabetes were limited to India's wealthiest people. But now, the poorest are also getting heavier. He said in poor areas of India, many people are thin because they are malnourished. But many other people are fat. But Dr. Misra is hopeful that the spread of obesity can be slowed. And he says it must start in the schools by giving all Indian children the same instruction on physical activity and diet. The World Health Organization says China is also moving up in obesity rates. The estimate has reached about 5% countrywide, and as high as 20% in some cities. And that's the VOA Special English Health Report. You can find transcripts, MP3s, and archives of our reports, and share your comments at voaspecialenglish.com. You can also find us on Facebook, Twitter, YouTube, and iTunes at VOA Learning English.
From VOA Learning English, this is the Health Report. The World Health Organization says there has been an increase in the number of children in developing countries who weigh too much. In African countries, the WHO says the number of overweight or obese children is 2 times as high as it was 20 years ago. Around the world, about 43 million children under the age of 5 were overweight in 2011. Doctors use height, weight, and age to measure whether a person is underweight, normal, overweight, or obese. Overweight and obese children are more likely to become overweight and obese adults. They are also at risk of developing health problems like diabetes and heart disease. Francesco Branca is the director of the WHO Department of Nutrition for Health and Development. He says governments should consider providing vitamins for children, and they should have policies on how food is marketed to children. But reducing the number of overweight children will not be easy. The goal is difficult to meet, even in wealthy countries. Experts say lowering obesity rates is especially complex in countries that also have high rates of infectious diseases. But the WHO has some basic solutions. The organization says people should eat less fat, sugar, salt, and processed food. This can be replaced with more fruits and vegetables and increased physical activity. These goals are especially important for children. The WHO also says mothers should breastfeed their babies for at least the first 6 months if possible. The current goal for the WHO's World Health Assembly is to prevent any increase in the percentage of overweight children in the next 12 years. For VOA Learning English, I'm Alex Villarreal.
From VOA Learning English, this is the Help Report. A top health expert warns that the world needs to deal with what he calls the first Ebola epidemic the world has known. Tom Frieden, director of the U.S. Centers for Disease Control, spoke to reporters at the CDC headquarters in Atlanta, Georgia. He warned that the Ebola outbreak in West Africa could spread widely. He said a huge global effort is needed to contain the disease. Dr. Frieden just returned from a visit to the most affected countries, Sierra Leone, Guinea, and Liberia. He said Ebola cases continue to increase quickly, even though healthcare workers are working extremely hard against the spread. News reports say the number of cases is more than 5,000. Dr. Frieden warned that there is a window of opportunity to stop Ebola, but he added that window is closing. The CDC chief said the Ebola virus is spreading in 2 ways, from patients to caregivers and through unsafe treatment of the dead. Dr. Frieden warned that each day's delay in dealing with the Ebola spread makes it more difficult to stop. The CDC director said resources, technical experts, and a worldwide organized and unified plan are needed. He said Ebola is not only an African problem, but a world problem. U.S. health officials have announced an agreement with a California-based drug maker, MAP Biopharmaceuticals. The deal calls for the company to speed development of the experimental Ebola medicine ZMapp. ZMapp has not been tested on humans, but 2 American medical missionaries who had Ebola were treated with the drug and recovered. For VOA Learning English, I'm Laurel Bowman. From VOA Learning English, this is the Health Report in Special English. New research shows that overweight or even slightly obese people have a lower risk of early death than people considered to be normal weight. Researchers examined the results of 97 studies. Most of the studies were less than 10 years old. They included almost 3 million adults from around the world, including the United States, Canada, China, Taiwan, Brazil, India, and Mexico. The research was carried out at the Centers for Disease Control and Prevention in the United States. The study found that people who were considered overweight or slightly obese were 5 to 6% less likely to die from all causes than people of normal weight. But people with higher obesity ratings had almost a 30% greater risk of death compared to normal weight individuals. Catherine Flegel led the study. She says she was not surprised that there was no higher risk for overweight people, but she had not thought that the risk of death was definitely lower. The study has raised new questions about body mass index, or BMI. This is a measurement of body fat as a ratio of height to weight. BMI guidelines were used for the study. In recent years, many public health experts have promoted body mass index as a way to predict the risk of health problems. But a person's BMI can be misleading. Stephen Heimsfield is head of the Pennington Biomedical Research Center in Louisiana. He says people can be physically fit and in good health, but might weigh more because they are more muscular. Still, he cautions that the study's findings should not be an excuse for people to add a few more pounds. For VOA Learning English, I'm Laurel Bowman.
From VOA Learning English, this is Health. More than 5,000 members of the Pakistani security forces have been killed fighting terrorists and militants since 2001. Twice as many regular and paramilitary troops have been wounded. But the high number of deaths and injuries has resulted in improved care at the Army's top rehabilitation center in Rawalpindi. Doctors at the rehabilitation center help injured troops regain physical and mental skills damaged in war. Aman Ullah lost both of his legs more than a year ago while serving in the Khyber tribal area on the border with Afghanistan. The 23-year-old is one of the thousands of Pakistani soldiers dealing with wounds from Pakistan's fight against militant groups. Most soldiers are wounded by improvised explosive devices, or IEDs. The soldiers are recovering from major medical operations at Rawalpindi's Armed Forces Institute for Rehabilitation Medicine, or AFIRM. Aman Ullah and several other soldiers are now hoping to compete in the next Paralympic Games. This international competition is for athletes with disabilities. The chief of the Rehabilitation Center says he is proud of the progress made in treating the patients. The experience of treating thousands of patients over the years has led to improved medical practices. These improvements include more useful artificial limbs to replace arms and legs lost to injuries. Medical workers have also developed other improved practices for helping wounded soldiers. There are plans to expand the Rawalpindi Rehabilitation Center. For VOA Learning English, I'm Carolyn Prasuti.
From VOA Learning English, this is the Health Report. Do people get happier with age? If you said yes, then you were right. A recent study found that people generally become happier and worry less after the age of 50. A team at Stony Brook University in New York asked people between the ages of 18 and 85 about their happiness. The researchers found that levels of stress were highest in adults between the ages of 22 and 25. Stress levels dropped sharply after people reached their 50s. Happiness was highest among the youngest adults and those in their early 70s. But those least likely to report feeling negative emotions were the oldest ones. The study also found that men and women have similar emotional patterns as they grow older. But women of all ages reported more sadness, stress, and worry than men. The researchers also considered possible influences, like having young children, being unemployed, or being single. But they found that these situations did not affect the levels of happiness and well-being related to age. So why would happiness increase with age? One theory is that as people get older, they become more thankful for what they have and have better control of their emotions. They also spend less time thinking about bad experiences. Happiness is not the only thing that seems to improve with age. Another study found that people in their 80s reported the fewest problems with their sleep. Researchers had expected to confirm the popular belief that sleep problems are connected to aging. The survey found an increase in sleep problems during middle age, especially in women. But overall, people reported that they felt their sleep quality improved with age. For VOA Learning English, I'm Alex Villarreal.